So who needs a lung transplant? Now we have the lungs, which are organs which act as air filters for us. So we have a number of disease conditions where both our lungs get affected simultaneously. It can be because of infection like tuberculosis, where bilaterally lungs can get infected. It can be in chronic smokers, where we have a condition called emphysema or inflation of your lungs. It can also be because of pulmonary fibrosis, where your soft lungs is slowly becoming fibrotic or rock-like. So these are three situations where your lung function is going to drop. Now, as the lung function progressively drops, we find that you will become progressively more breathless. You will ultimately reach a situation where you will require oxygen for performing your daily activities. Now, when your pulmonary function drops to nearly 1/3 of normal, that is when you find that oxygen will be required for your daily activities. Now, that is one indication, and probably the most important indication for performing a lung transplant, that you require oxygen for your daily activities, you require oxygen during your sleep. The second thing would be that your heart also starts getting affected because of your decreased lung function. Now, how can we find that out? We do an echocardiogram, a 2D echocardiogram of the heart, where we can actually see the pressures in the heart is also going up because you are having a damaged lung. The third indication, you also will require a lung transplant if we find that you are having a progressive deterioration in your pulmonary function, which is pretty rapid. Like, you test your pulmonary function every 6 monthly, and if you find that the drop is more than 10%, your drop in pulmonary function is more than 10% 6 monthly, then that is also an indication for performing a lung transplant.